My area of research is looking at vaccines, both the benefits and the safety. As a paediatrician and an infectious disease specialist for the last 20 years, I've been able to care for children who have had terrible diseases that could have been prevented by vaccination. And then much less commonly, I've been able to also support families where they've had doubts about vaccine safety, either for themselves as adults or for their children. So having that work, it's really stimulated a body of research that is all about looking at vaccines in programs and their real world impacts in terms of benefits and risks. One example of the research that I've been involved in and been very lucky to lead with a fantastic team of colleagues is a new safety surveillance system called AusVac Safety. Around the world, the usual way of monitoring the safety of medicines or vaccines once they're licensed and used in large numbers of people are to just rely on passive reports from doctors or nurses. So if someone's experienced a reaction, the doctor or nurse might send a report in. Unfortunately, that passive reporting system for safety doesn't give us a real full picture of how the vaccine is performing in tens of thousands or even millions of people. So arising out of an event that occurred in Australia in 2010, where there was a particular safety concern around one brand of influenza vaccine in children, many researchers in Australia, including our own group, did some work to develop new systems of contacting patients after they'd been vaccinated. This is based on SMS reporting back from patients about 3 days after they've received a vaccine, and is fully automated. So we're using the power of people to give us information that we can then leverage and turn into research. And it has been recognised as important, as the Australian Government Department of Health have recently awarded us a large 4-year contract to have this system active in every state and territory in Australia, in people of all ages and across all vaccines funded under the National Immunisation Program. I think there are a number of factors that are important in ensuring that research findings go beyond publication to having a real world impact. That is in developing the research itself to ensure that you're focused on what an impact of the work might be. And I think for particularly young researchers, that's enabled by having a broad range of views of the research that they're doing, by understanding how it fits in a larger picture. I've been very lucky in my career to have had the experience of working directly with children who've experienced the diseases that we're trying to prevent, as well as working in a laboratory environment where a new vaccine was being developed. So having that diverse range of experiences, I think, can help you place your research and make it more translatable in the policy and practice. A second important point that I feel really strongly about is the strength of collaborating with others. I wouldn't be sitting here today accepting this award if it wasn't for the great team and all of the people who actually do this work together. And I would really like to pay tribute to them, as well as saying that if we come together as a whole to answer complex problems and improve policy and programs, we'll really achieve a lot more. And one third thing would be just to be always thinking about evaluating, measuring and getting feedback on what you do. I think it's just critical to get those sort of outcome measures that really do allow you to evaluate the impact of your work and strive to do better.